Hello, this is Dr. Marty Harris, and today's topic is physical disabilities and other health impairments. Typically, when we first think about physical disabilities, we have an image in our minds. That image includes some aspect of a person's physical being that we can immediately see as a disability. Perhaps part of that image includes wheelchair or crutches or an obvious deformity of limbs or rigid, unusual mobility. When we think about health disabilities, there may not be an image of obvious physical differences, but perhaps the first thought that comes to mind is that that individual is weak and frail. Our reactions to individuals with physical or health disabilities may be influenced by society's standards of beauty. In part, these images and first thoughts concerning physical and health disabilities are fraught with stereotypes. It has been said that in part, the reaction to physical disabilities is shaped by our own fear that we too could experience an accident that would lead us to have a physical disability. To move past these stereotypes and fears, we need to become more knowledgeable about physical disabilities, and we need to work at seeing the person first rather than the disability first. So let's begin our knowledge building by looking at the terms. The terms physical and health disabilities are generic terms that cover orthopedic impairments, other health impairments, health disabilities, special health care needs, multiple disabilities, spinal cord injuries, neurological disorders, and severe disabilities. Specifically, physical and health disabilities involve the function of the muscles, joints, bones, and the physical stamina of an individual, and can impact a child's ability to participate and a child's educational performance. Dr. Deborah Smith gives us an organizational scheme to address the numerous topics included under the umbrella of physical and health disabilities. There are two extra topics we need to think about as we look at this chart. One is TBI, traumatic brain injury, and the other is ADHD. In 1990, Congress considered adding TBI to the OHI category. It was decided that TBI should be a federal category of disability outside of OHI. In IDEA 2004, Congress debated whether to have ADHD be a federal category. It was decided to include ADHD within OHI and not make ADHD a federal category of disability by itself. We will study ADHD and TBI as separate topics within this course. Within this lecture, we will not be able to describe each of the topics listed by Dr. Smith's chart. We will focus on the impact and the resulting educational needs. But right now, take time to read through this chart. About physical disabilities, we must recognize that neurological impairments and orthopedic impairments may combine or independently have the same result. Just look at this Venn diagram and you'll understand that both neurology and orthopedic functions influence and create the output of movement and feelings. Neurological impairments involve the central nervous system, affecting the individual's ability to move, feel, or control certain parts of the body. Orthopedic impairments involve the skeletal system, the bones, joints, limbs, and associated muscles. These all impact movement and feeling. Neurological and orthopedic impairments are two distinct and separate types of disabilities, but they may cause similar limitations of output. Definition of orthopedic impairment: a severe orthopedic impairment that adversely affects the child's educational performance. It may include impairments caused by congenital abnormalities, birth defects, disease, accidents, and hereditary factors. Here are 3 examples of neurological physical disabilities: cerebral palsy, epilepsy, and spina bifida. Cerebral palsy, or CP, is a motor disability caused by brain dysfunction within the motor strip. The motor strip is responsible for the large muscles and the movements of the 4 limbs. CP is not a paralysis. CP is not a disease. Cerebral palsy is a physical condition. The term condition implies that the physical problem exists over time with slow changes and improvements, but it doesn't go away. A disease is something you catch, either viral or bacterial, and with medication, it will go away. Remember, cerebral palsy is not a disease, it is a physical condition. Epilepsy is an electrochemical imbalance in the brain. It is an overabundance of electro signals that cause seizures. Seizures can range from mild to severe. Review your textbook for more details or go to a reliable internet source. Spina bifida is a common birth defect that involves a hole in the spine. Again, there are various degrees of physical limitations based upon where the hole in the spine is located and the size of the hole. Early detection and surgery can address this spinal deformity. In fact, some surgeries are performed while the baby is still in the womb. Finally, research has indicated that this birth defect, spina bifida, can be prevented by women taking folic acid. Orthopedic physical disabilities. The definition is an impairment that interferes with normal functions of the bones, joints, and muscles. 2 examples are muscular dystrophy and dwarfism. There are several types of muscular dystrophy, and Duchenne dystrophy is the most common. There are several different types of dwarfism as well. As to etiology, we do know that bone, joint, and muscular diseases cause orthopedic impairments. Genetics that impact the bone, joint, or muscular formation or function also cause orthopedic impairments. And finally, injuries. Let's talk about dwarfism for a minute. Dwarfism is an example of a genetic skeletal condition that impacts growth and mobility. However, it does not impact intellectual functioning. Specific health problems are frequently associated with dwarfism, But as Matt and Amy Roloff on Small People in a Big World like to say, little people can do just about anything. We just do it in a different way. Paralysis is a neurological impairment in the central nervous system that causes paralysis. However, the result of the paralysis is that muscles do not respond, and therefore muscles may deteriorate. Paralysis terms include monoplegic, paraplegic, hemiplegic, quadriplegic, triplegic, diplegic, double hemiplegic, and spinal cord injury. Review your textbook or reliable internet sources to learn more about the newest medical advances and treatments for paralysis. Definition of other health impairment: having limited strength, vitality, or alertness due to chronic or acute health problems that adversely affect educational performance. Chronic condition develops slowly, and they are long-lasting symptoms. Acute condition develops quickly. The symptoms are very intense, but the symptoms may last for a short period of time. What are some examples? Heart condition, tuberculosis, rheumatic fever, asthma, sickle cell anemia, hemophilia, seizure disorders, lead poisoning, leukemia, diabetes, and attention deficit hyperactive disorder. Here are the types of illnesses that are related to other health impairments: immunodeficiency, respiratory, metabolism, cancer, seizure disorders, circulatory, specific disorder or disease of an organ or an entire system. That would be kidney, liver, or arthritis. AIDS and HIV. We still respond to AIDS with great fear. Asthma and cystic fibrosis are examples of respiratory health conditions. Asthma is on the increase and is the #1 cause of absenteeism in our schools. Examples of metabolical health conditions are diabetes, hyperglycemia, or hypoglycemia. Juvenile diabetes is on the rise in the United States. Why? Sugar, junk food, lack of exercise, lots of TVs and computers. The obesity of our children is now at an epidemic level, and obesity leads to diabetes. Leukemia is the most common childhood cancer. Epilepsy is the most common seizure disorders, but there are many others. Hemophilia and sickle cell anemia are examples of circulatory health conditions. Sickle cell anemia is very high in the African American population, and it is an extremely painful illness. There is no single prevalence figure for the number of individuals with physical and health impairments because students can be counted in different areas and may have more than one disability. Also, not every child with physical or health disabilities may require special education services. Consider these figures. Cerebral Palsy Foundation in 2004 reports 764,000 children and adults, 8,000 infants, and 1,300 preschoolers with cerebral palsy. Spina Bifida Association in 2004 reports that 1 out of every 1,000 newborns will have spina bifida. Epilepsy Foundation of America in 2004 reports approximately 45,000 children under the age of 15 years develop epilepsy each year, and more than 2.5 million, that's 2.5 million Americans are currently diagnosed with epilepsy. American Lung Association reports 6 million children under the age of 18 years have asthma. As you probably know, smoking has increased with our teenagers, and secondhand smoke in any household can cause an infant, toddler, preschooler, or anyone else living in that house to have asthma. The Center for Disease Control estimates that 900,000 Americans have AIDS, including 9,300 children under the age of 13. Let's talk about the bell curve and physical disabilities and health impairments. Physical disabilities and health impairments occur across the bell curve. It is a mistake to assume that all people in a wheelchair are unintelligent. It is a mistake to assume that a child who cannot talk is unintelligent. We must recognize that those with lower cognitive abilities may have greater difficulty adjusting to the demands of a physical or health problem. We must recognize that there is often a higher prevalence of intellectual disability associated with certain health or physical conditions. For example, nearly half the children with cerebral palsy also have some degree of cognitive disabilities, but it would be a mistake to assume that all individuals with cerebral palsy have cognitive disabilities. We must understand that for some health conditions, there is a higher prevalence within the group of students with cognitive disabilities. For example, students with intellectual and developmental disabilities, IDD, we used to call it MR, have a higher incidence of seizure disorders than we find in the general population. Knowing that fact, we must be careful not to overgeneralize and assume that all people with epilepsy have low intelligence. Finally, we must talk about our own feelings when it comes to students with physical and health disabilities. Physical and health disabilities invoke feelings of pity or sympathetic reactions from many people. But as educators, pity and sympathy must be put aside. Individuals who have physical and health disabilities don't want our sympathy and don't need our pity. As educators, we need to set high expectations for these students. We need to respect the student as an individual and ensure that he or she has a special education every day, full of inclusion and empowerment. Thanks for listening.